Hello, everyone, and welcome to Shaddai English Academy. I'm Teacher Orlando, and this is today's lesson. Health matters. Health is so important. When you don't feel well, you should go to the hospital, or you can ask somebody to drive you to the hospital. What are you going to learn in this lesson? You'll learn how to show concern and offer help, make a medical or dental appointment, discuss types of treatments, and talk about medications. Let's see some phrases and vocabulary. Dental problems, red or swollen gums, a broken tooth, a loose tooth, fillings. If you have any of these dental problems, you should go to a dentist. When you want someone to recommend you a good place or a good doctor, you can ask, could you recommend a good dentist? Could you recommend a good hospital? Or you can say, I was wondering if you might be able to recommend a good dentist or a good clinic. Describing symptoms. I feel weak. I've been vomiting. I have a pain in my chest. You will see more vocabulary about how to describe symptoms. Offering help to someone who is not feeling well. If there is someone that is not feeling well, you can offer that person help by asking these questions. Would you like me to have or to make a doctor's appointment? Would you like me to drive you to a hospital or a clinic? Would you like me to pick up something from a pharmacy? Would you like me to bring some soup or tea? Making a medical appointment. You're gonna learn how to make a medical appointment in this lesson as well. After I finish with this explanation, there will be a lot of vocabulary conversations that you'll see here and that you're gonna learn and put into practice as well. Talk about medications, vitamins, painkiller, and other types of medications that we use and when we don't feel well. Grammar, drawing conclusion with must. You can use must to draw a conclusion to infer about something or to indicate that you think something is probably true. For example, to draw a conclusion. Somebody's telling you, I think I just broke my tooth. So you can tell the person, oh no, that must hurt. So you are inferring how that person should feel. The doctor said I should come in the next week. That's good. It must not be an emergency. So you think that is not an emergency because the doctor told the person that she or he can come next week. Will be able to talk about future ability. The doctor will be able to see you tomorrow. It's the same as the doctor can see you tomorrow. Modals may and might to talk about possibility. The dentist may or might arrive at the office a little late this morning. You can also say the dentist may or might not arrive. You can also say in the first sentence, the doctor will be able to, that doctor won't be able to. Be able with may and might for possibility or with must for drawing conclusions. The doctor may or might be able to see you tomorrow. The doctor might be able to see you next week. We must be able to park here. See the sign. Well, this is everything so far. So now it's your turn to continue exploring the lesson, listening to the different conversations and vocabulary, and I hope that you can learn a lot in this lesson.
Someone with a dental emergency during a trip.
I need to see a dentist as soon as possible. I think it's an emergency. I was wondering if you might be able to recommend someone who speaks English.
Let me check. Actually, there is one not far from here. Would you like me to make an appointment for you?
If you could, thanks. I'm in a lot of pain.
So, I hear you're from overseas.
From Ecuador. Thanks for fitting me in.
Luckily, I had a cancellation. So, what brings you in today?
Well, this tooth is killing me.
When did it first begin to hurt?
It's been bothering me since last night.
Let's have a look. Open wide.
Ah.
Well, let's take an X-ray and see what's going on.
Read and listen.
I feel dizzy. I feel nauseous. I feel weak. I feel short of breath.
I've been vomiting. I've been coughing. I've been sneezing. I've been wheezing.
I have pain in my chest. I have pain in my hip. I have pain in my ribs. I have pain in my stomach.
Listen and check the symptoms each patient describes. Conversation 1.
What seems to be the problem today, Mrs. Gillis?
Well, I've been feeling pretty dizzy for the last few days. I have to lie down all the time. I feel really weak and I have so little energy. I can't even make myself lunch or dinner.
I'm sorry to hear that.
And I can hardly walk upstairs. I'm so short of breath whenever I try.
Any pain?
Funny you should ask. I have pain in my shoulder, too.
Conversation 2.
Is there anything bothering you today, Mr. Baker?
Well, when I woke up this morning, I felt terrible. I had this pain in the back of my neck, and I thought I'd better get in to see the doctor right away.
Have you been coughing?
A lot, actually. I've had a bad cold for over a week now.
That might explain the pain you've been feeling in your neck. I'm going to give you something for that cold.
Conversation 3.
The doctor will be right with you, Miss Rice. Have you not been feeling well?
Not great, actually, and I've been sneezing like crazy.
Oh, that's too bad.
Anyway, today my back is killing me, so I thought, that's it. I'd better come in.
Come, I'll take you in to see the doctor.
Conversation 4.
You're here to see Dr. Fox?
Yes, I am. I've been really sick.
Oh, I'm sorry to hear that. Have you been nauseous?
Oh, yeah.
Any vomiting?
Yes. I'm afraid I've been throwing up everything I eat.
Any dizziness?
Not really, just nauseousness.
Well, Dr. Fox will be with you in a moment.
Conversation 5.
You're Ms. Perlman?
Yes, I am.
The doctor will be with you soon. Can I ask you a few questions?
Okay.
What brings you in today?
Well, I've been wheezing a lot since yesterday. I don't know what's wrong. It's really annoying.
Are you allergic to anything?
Not that I can think of.
Any other symptoms?
Not really.
Conversation 6.
Mr. Rashid?
That's me.
Hello, Mr. Rashid. The doctor will see you in just a moment. Are you in a lot of pain?
Well, my hip has been bothering me a lot for the past 2 days. It hurts all the time.
Did you fall or have an accident?
Not that I can remember.
Any pain anywhere else? In your knees? Your elbows?
No.
Listen again. If the patient has pain, write where it is. Read and listen. 1,
I feel weak and dizzy.
2,
I've been sneezing, coughing, and wheezing.
3,
I have pain in my neck, my shoulders, my back, and my hip.
Now listen again and repeat. Read and listen to someone showing concern and offering help.
I'm sorry, but I don't think I can come to the meeting this morning.
Really? Is there anything wrong?
Well, actually, I don't feel very well. I've been coughing since last night, and I feel a little short of breath.
Oh no, that must be awful. Would you like me to call a doctor?
That's really nice of you, but I'm sure I'll be fine.
Then call me later and let me know how you feel, okay?
I will. Thanks.
Read and listen.
A checkup. An examination.
A shot. An injection.
An EKG. An electrocardiogram.
An X-ray.
A blood test.
Read and listen to someone making a medical appointment.
Hello, Dr. Starr's office. Can I help you?
Hello, this is Ann Webb. I need to make an appointment for a blood test. I wonder if I might be able to come in early next week.
Let's see if I can fit you in. How about Tuesday?
Could I come in the morning?
Let me check. Would you be able to be here at 10 o'clock?
That would be perfect.
We'll see you then.
Thanks. I really appreciate it.
Read and listen.
Consider the choices. Conventional medicine. The beginnings of conventional medicine can be traced back to the 5th century BCE in ancient Greece. It is based on the scientific study of the human body and illness. In the last century, there has been great progress in what doctors have been able to do with modern surgery and new medications. These scientific advances have made conventional medicine the method many people choose first when they need medical treatments. Homeopathy. Homeopathy was founded in the late 18th century in Germany. It is a low-cost system of natural medicine used by hundreds of millions of people worldwide. In homeopathy, a patient's symptoms are treated with remedies that cause similar symptoms. The remedy is taken in very diluted form, 1 part remedy to 1 trillion parts water. Acupuncture. Acupuncture originated in China over 5,000 years ago. Today, it is used worldwide for a variety of problems. Acupuncture needles are inserted at certain points on the body to relieve pain and/or restore health. Many believe acupuncture may be effective in helping people stop smoking as well. Herbal therapy. Herbal medicine, often taken as teas or pills, has been practiced for thousands of years in almost all cultures around the world. In fact, many conventional medicines were discovered by scientists studying traditional uses of herbs for medical purposes. The World Health Organization claims that 80% of the world's population uses herbal therapies for their regular health care. Spiritual healing. Also known as faith healing or mind and body connection, various forms of spiritual healing exist around the world. This is a form of healing that uses the mind or religious faith to treat illness. A number of conventional doctors say that when they have not been able to help a patient, spiritual healing just may work.
Read and listen.
A painkiller. Cold tablets. A nasal spray. A decongestant. Eye drops. An antihistamine.
Cough medicine. An antibiotic. An antacid. An ointment. Vitamins.
Listen and repeat.
Dosage. Warnings. Side effects.
Listen to each conversation with a doctor. Use the medications vocabulary above and the symptoms vocabulary from page 16 to complete the chart for each patient. Conversation 1.
Ms. Yilmaz, I'm Dr. Lee. I understand you're here on business?
That's right. I'm from Turkey, actually.
And you are not feeling well?
No, I'm afraid not. My back has been killing me for several days now.
Are you taking anything?
Just some painkillers, but they're not really helping.
Let me give you a prescription for a stronger painkiller. I think you might find it very helpful.
Does it have any side effects?
Well, for very few patients, it causes nausea or vomiting, but that's very rare. I really don't think you'll have to worry. Call me if you feel at all nauseous, okay?
Okay, thanks.
The dosage is 1 tablet in the morning, 1 in the evening with food. The pharmacist will give you a full set of instructions when you pick up your prescription.
Thank you, Dr. Lee.
Conversation 2.
Lucy Fernandez? I'm Dr. Hirano.
Thanks so much for fitting me in.
My pleasure. Where are you from?
Mexico. I'm here on business.
Oh, you're a long way from home. What can I do for you today?
Well, I've got a splitting headache, and I've been kind of nauseous since Monday.
You must feel terrible. Are you currently taking any medication?
I've been taking an antacid and a painkiller.
Are you allergic to any medications?
I think I might be allergic to penicillin, but I'm not sure.
Well, that's okay. Keep taking the painkiller for that headache, but you can stop taking the antacid. I'm going to give you a prescription for your nausea. Take it twice a day.
Will there be any side effects?
It might make you a little tired during the day, but chances are you'll be fine. Call me if you don't feel better.
Conversation 3.
Dr. Benson? Hi, I'm Mark Go.
Hello, Mr. Go. I hear you're not from around here.
Right. I'm visiting from Hong Kong for a few weeks.
You've come a long way to see a doctor. Well, what can I do for you today?
My eyes have been really red for about a week now.
Have you been using any medication?
Well, I got some eye drops at the drugstore, but they aren't helping.
For your condition, I think you might want something stronger. I'm going to give you a prescription for an eye ointment. Use it twice a day and wash your eyes several times a day.
Okay.
It's a strong medication, but there aren't any side effects you need to worry about. If you keep your eyes clean, the ointment should do the trick.
Thanks.
Will you still be here next week? I'd like you to come back to see me.
Yes, I'll still be here.
Good. You can make an appointment at the front desk on your way out.
Thanks, Doctor.
Listen to each conversation and complete the statements. Then listen again to check your answers. Conversation 1.
So, what's bothering you today?
Well, I've had some pain in my tooth. Here, on the right side.
Let's have a look. It looks like you lost a filling.
Really? My regular dentist just put that in a month ago.
Have you eaten anything hard or chewy or crunchy lately?
Uh-oh. I think that's it. It was probably that candy I ate 2 days ago.
Well, how about we take care of that right now, okay?
Thanks.
Conversation 2.
Thanks for fitting me in. I've been sneezing like crazy all day. I thought I'd better come in and get something.
Allergies?
Mm-hmm. I get them every spring at this time. I don't know if it's the trees or the flowers or what, but my eyes get red, I sneeze.
Well, I can give you a prescription to take care of that. Clear 8 is a very good antihistamine.
Thanks. I'd really appreciate that.
Conversation 3.
You must be in a lot of pain.
I am. My leg really hurts a lot.
You said you were skiing?
Yes. I guess I went a little too fast.
Well, don't worry about that now. Let's get you into radiology and then we'll know if you've broken anything or not. Have you ever been x-rayed before?
Just for my teeth.
Conversation 4.
You look like you're in a lot of pain.
Yes. My back's been killing me for several days now. I've been taking painkillers several times a day.
And that hasn't helped?
Not really. I still can't sit. I can't stand. All I can do is lie down.
Well, I could write you a prescription for a stronger medication if you like. That might help.
I don't know. Everyone says acupuncture is good for pain. Do you think I should try that?
Sometimes it helps. I could give you a referral if you like.
I'd like that. I need to try something else.